Welcome, everyone, and thank you for joining us today. Discussion today is Dogs with Disabilities, with focus of care on the down dog. Our presenter is Dr. Adam Christman. He is the Chief Veterinary Officer at Fetch DVM 360, the #1 medical multimedia company in the country. He has pivoted from full-time practicing veterinarian to part-time both in shelter medicine and emergency medicine. He received his DVM degree from Iowa State University College of Veterinary Medicine and his MBA from Aspen University. Dr. Christman is an adjunct professor and course coordinator of the Veterinary Assistant Program at his local college. He has co-authored a book entitled, "Honey, Have You Squeezed the Dachshund? A Pet Owner's Guide to Dealing with Dogs and Disabilities." Dr. Christman is a huge fitness enthusiast and has a great love for his 4 fur babies, Chelsea, Connor, Carl, and Clark W. Griswold. Christman believes every person deserves to experience the love of the human-animal bond. He is an international speaker on leadership, client service, and creating a solid culture for veterinary hospitals. We welcome Dr. Christman.
Well, thank you so much, Carolyn, for that introduction. And every time I hear my fur babies' names, it just puts such a smile on my face. And I'm sure it does with you that are tuning in too with your fur babies when they say their names. It really warms your heart. And, I love this conversation that we're having today because we all know that animals are really incredible, period, end of story. But then you throw on top of that dogs, and cats for that matter, or any animal with disabilities, and it just really heightens your respect for the love of who they are. And we're going to talk about some of the disabilities that you may encounter along the way. And let's first talk about resilience. We're being resilient during this pandemic right now. Our profession has learned to pivot and learn to adapt in ways that we have never adapted before, with telemedicine and curbside check-in, socially distancing, but still practicing. Cut to animals that really have nailed down being resilient and adaptive for many, many, many years. And look at this picture that you see in front of you right now today, is that they're happy. They're happy, they're smiling, they love you unconditionally no matter what. Yes, they may have a limb amputation for reasons that we'll talk about, but dogs, I always say historically, or 4 legs, and 3 legs with a spare, honestly, because when they come in for a lameness issue, they really learn to adapt and be resilient and overcome challenges that you and I would take years to do that they can just do in a matter of days and a couple of weeks. And so, these guys, regardless of age, they really, really compensate well for their day-to-day activities. And the question comes to you, whereas you as a pet parent may say, how is this gonna affect me? How is this going to affect the relationship that I'm gonna have with my fur baby? I don't want it to change. I mean, we're very good at anthropomorphizing our fur babies. I feel bad for them. Like, I feel horrible. Like, you look at this picture on the left, and this poor baby not only is paralyzed in the back legs or the pelvic limbs, but also has an eye that was enucleated or surgically removed on the left eye. But they're still, like, basically what this one is saying is, she's like, where's the cookie? That's all she really cares about. But they have adapted and adjusted to these changes. And the one on the right is something that is very familiar to you and I, and we see dogs with diabetes often. And subsequently to that is they can develop hypermature cataracts that can happen. Now, there are options for those things, or there's surgery for it. There's something called phacoemulsification that can happen, where you can, get some of that out of the eye and put lens implants in. Some pet parents cannot afford that, and therefore, they can live a very incredible, healthy, normal life, because let me tell you, that nose is everything, everybody that's tuning in. And you know that, right? You as a pet parent know that if you're around, they are sniffing for you. They know where their cookies are. They know where the cookie jar is. So they know, and they adapt really well to it. So let's chat a little bit about reasons for a limb loss. Like, why do I surgically remove a leg? It's not because we want to, it's because we have to. And so there are several reasons that you see in front of you. And the first one that comes to mind often is trauma. Unfortunately, hit by cars happen. Whether or not dogs are going outside and they go out chasing after a squirrel or a chipmunk, they end up underneath a fence. and all of a sudden their leg gets completely macerated. Infection, sepsis is also known as a bacterial infection. So we have to have these conversations in the exam rooms that are challenging ones. The other reasons for it could be cancer, such as osteosarcoma or fibrosarcoma. I think probably as a veterinarian, for me at least, giving a diagnosis of an osteosarcoma is an instant life-changing alteration for both the dog as well as for the pet parent, because there are a series of events that need to happen, and they're drastic ones where we have to talk about surgically amputating the leg. We have to talk about chemotherapy, and then we have to talk about integrative medicine, whatever that looks like in terms of rehabilitation. So there's a conversation that needs to happen. And neuropathy can happen too. So let's say, for instance, I had a dog that came to me. His name was Rusty. I'll never forget him. He was just a wonderful dog. He came in at the age of 2, the most incredible pet parents that he could ever have. He accidentally got out and he got hit by a car. And so we thought that we would be able to salvage his right thoracic limb, but he developed a neuropathy. In other words, he couldn't feel that right front leg. He ended up actually chewing his leg. He chewed right up to the carpus and created all these other things, a sepsis, a cascade of events. So I had to tell mom and dad, we need to amputate the leg because he doesn't know any different and he's going to create a horrific infection. We ended up doing the leg amputation, and he lived, you guys, until he was 14 years young. So he did, and he had a remarkable journey. He compensated well. He did the head bob. But, you know, he ended up having kidney issues that ultimately was the end for him. But he lived another 10 or 12 years actually for that. So, you know, this isn't the end all be all. And we're so creative in this profession too. Making this difficult decision as a pet parent and as a veterinarian is difficult. There are significant emotions that come into play. Now, think about this. I want you to think about your everyday to day activities of, you know, loving your dog, right? And then what happens overnight, you know, by tomorrow, something happens where I have to tell you as a veterinarian that we need to amputate the leg. Can you imagine the crying that happens? And I cry with you, and I'm a pet parent too. So when that happens, there's a lot of emotions that come into play. So we need to understand that, of course, it's an emotionally sad time that we have to make together, but we also have to overcome those emotions to do what's best for the fur baby. And so whether it be something that you see on the right, where we do end up taking off the leg and there's a nub that's present from the humerus down, they created basically an artificial limb for this dog that incredibly adapted well to it. Some dogs don't, some do. So it's worth always giving it a shot. But there's also a financial consideration that comes into this. We're not talking about a couple $100 worth of surgery plus, you know, rehabilitation. We're looking at a few $1,000s here. So it's something that we have to be financially responsible for at the same time. So there's that. And then also time. I can begin to tell you, when I have done leg amputations, I have had almost all of my pet parents take some sort of time off of work because they wanted to be home with them, whether it be, you know, their spouse, significant other. They did 4 days off while the other one did the next week with 4 days off, because you're going to have to be home for them. And I set the expectations right then and there to be like, not negative Nancy, but also to create the expectation knowing that we're going to need your help. I need your help, mom and dad, with this after surgery, post-op. We're going to need some time together to talk about laser therapy, acupuncture, and other things that we're going to talk about. So, and then the big question is, how will he or she bounce back from this? And 99% of the time, they will be fine. They will be fine. They adapt. They are resilient, like we said. They are able to overcome challenges that you and I probably would not have been able to. So leg amputations can be, you know, somewhat of a scary thing, but not impossible. Let's chat about eye nucleation too. I mean, let's call it what it is. Let's look at Cooper, for instance, 6-year-old Australian cattle dog. The first thing that you and I would probably would say would be like, oh, you know, he has no eyes, you know? And so when you're walking, if you were Cooper's pet parent and you're walking him down the boardwalk, let's say, or taking him on a walk, people are going to look and stare. It's a society of what we live in. And so there's a look that you get concerned with. So having that conversation with these pet parents to say, he's going to look different, but his life is going to be a little bit of a challenge, but not impossible. So reasons for an eye enucleation, and enucleation means a surgical removal of the eyes. It could be, say, trauma. Glaucoma is notorious for that. Sometimes a fungal infection like our friend Cooper had. he had something called blastomycosis, which is a fungal infection that can go to the eyes and cause severe pain and inflammation and infection, where it's better off just removing the eyes for keeping him healthy. And then there's considerations like we talked about for a limb amputation: cost, blindness, appearance. And there's also silicone ocular implants that you can actually put in the socket of the eye. So after you close it and you remove the eyelids, it can kind of give it like a seamless look, so that way they don't look so sunken in from the sockets. Now, dogs that are blind, everyone that knows this probably realizes that it's not impossible. Cooper had a sibling, and mom was very taken back and concerned about these things. But I want to share with you the testimonial that she wrote back to us and to our colleague, because it's something that resonates really well with me. And it's the reason why I continue to do what we do every day. And she says that it was amazing. The dogs got along immediately, and Cooper soon worked out where everything was, that the water bowl was by the tank stand and how to find it. I watched him one day, stepped off the veranda, turned right out, and walked towards the tank stand. However, this time he brushed the lemon tree with his right side instead of his left, and he missed this tank stand. He immediately turned back, found his way onto the veranda, and started the process again, this time finding the water. So after 4 days, it was obvious that things would work out. Cooper and Bailey continued to get on well together, enjoying their evening walks and their neighbor's dog. Before Cooper had vision, I would have said he was a happy dog. But Dr. Warren was right. Without his eyes, he was even happier. He was in so much pain with glaucoma. Cooper and Bailey continued to get along well, and much to Bailey's delight, they even worked out to play on how to play with one another. It is wonderful to see them gently growl and chew at each other's necks. First one on the ground and then the other, as if Bailey knows that Cooper had a disability, as he is not so gentle with the neighbor's dog. We are all continually amazed how Cooper has adapted to his new life and environment. This just really hits all the feels, right? Everybody that's watching this, because if this was you and me or you and I, and we were a pet parent and, we're concerned, and you hear Cooper's story, my gosh, our dogs can do that too. They can adapt and they can figure things out. Like I said, the nose is everything. And, there are some things that you can do with when their eyes are gone, and ways to adapt. And here are some things that you can do. You can use voice commands, and they're everything. So like step, wait, watch, hold on. You could use your inflections depending on your voice tones, so they know which ones it's time to go out. You can go up on the inflection. You want to get a cookie, or in terms of a negative kind of a behavior, and they'll assimilate those things. Noises such as like whistles or clickers. I have a lot of pet parents that use whistle. So in terms of like rewarding a positive behavior, definitely remove sharp objects. So if you have like very pointy, like glass tables and things like that, that's the last thing that you're going to want in your house, because of the fact that if they go into it, they can really hurt themselves and cut themselves. So you don't want that to happen. And I always try to let the pet parents know about furniture changes and all those things, because they are going to bump into things. So when you take them home from the hospital and you're doing the rehabilitation, the number one problem, first and foremost, is going to be the cone of shame around their eyes. So around their head, because they're going to want to try to scratch at their eyes, because they're going to feel like the stitches trying to heal up and everything. So when you have their eyes removed, that's one thing that happens. Now, dogs that could develop something called SARD, sudden acute retinal syndrome, they don't have to have their eyes removed. They can still have their eyes. So you don't need to deal with like the cone of shame around their head, but they have to figure things out around their house. So you don't want to move things, especially like their bed, their food, their water dishes. Keep those normal, because they're going to be smelling those things and hearing your commands associated with those. So I would try to keep those to a bare minimum. Keep in mind of steps in the house. You might want to consider maybe a ramp for them too. So it might be easier for them to go down on since they're blind. But those are big things. And then the other thing that you may or may not have considered are fire hazards. I would say a hard no to candles in the house. And even like the waxy material ones, like there was an instance I had a golden retriever that was blind, knocked it over, but developed a scalding on his back from it because he didn't know it was there and it was on, and all the oil poured off onto him. So, especially even with cats that are blind too, and obviously, cats like to jump on counters and so forth. So, their tail goes over there, they can really develop, horrific burns. So you don't want those things to happen to your fur babies. I want to share a pink piglet puppy with you, because he is a little man that just continues to inspire me every day. And If you haven't followed him on Instagram, you need to. He has over 200,000 followers on Instagram. And by the look at his profile picture, you can see why. And mom is Dr. Melissa Shapiro, and she is a veterinarian and does incredible work on dogs and cats with disabilities. And so he has a whole profile page of things, but he is a double dapple blind Merle. I forget what the whole thing is, but he's blind and deaf at the same time. So he lived a whole life like this. So mom decided to take him in and take him under her wing and really add her to the pack. And this dog is he just warms my heart. I mean, you have t-shirts on him. There's like swag on Pink Piglet. And I want to just show you the video of what Melissa does and how well behaved. I mean, think about if your pack could do this, but watch Pink Piglet, because remember, this is a blind and deaf dog, and I'll tell you afterwards what she does to get him doing his thing there. Let me just hit play. Got them all. Now she's got to get Piggy. Still waiting. And that's incredible, right? You guys, I mean, that's just amazing. So she has trained him she uses her breath to blow on him, and she uses taps. So she tapped him on the left side to sit. And tapped him underneath the neck when to come. And so he knows those assimilations, and then she'll blow into his nose to give him a command as if like he's doing a great job, and then reward him with a treat accordingly. That's unbelievable, right? To know that he was waiting to go, but not hearing anything, seeing anything, but it's all through scent and then touch. So absolutely incredible. So shout out to you, Pink Piglet. Thank you for inspiring us every day for what you do. I want you to meet, the reason why I talk about this is my first son, and he's my inspiration in my world. He passed away a couple years ago, but I want you to meet Cosmo. Cosmo's a 14-year-old long-haired dachshund. He's absolutely handsome, isn't he, you guys? Oh, gosh, look at him. So he was a patient of mine when he was 2. So this is him in his senior years. So he was 2. He presented for being non-ambulatory. He had a large, firm, distended urinary bladder, and he had loss of both superficial pain and deep pain to his pelvic limbs. Now, what that means is if you have a dog, the dogs that are long back dogs, so think of the Basset Hounds, the Corgis, the Dachshunds, it's as if the Lord could have created another pair of legs underneath their T12 and T13 area on their back, I think they would get away with it, but they're long. So they're prone to having discs that are slipping. So at the time of presentation, he went to go chase a squirrel, and then he went, boom, down for the count. And see the way he's sitting there too? That's not a normal sit. That's not a normal gait sit is what we call it for when these dogs are sitting. And so he's kind of sitting on his hiney with his legs out, but this is many years ago. But it was very painful along the area. And so he had a loss of a paniculus response. And what that means is if you are going to touch somebody along their back or whatever, like it pinches, you feel it. But what happens when you don't feel it? So that's where like probably most likely the disc issue is, because when you don't feel it is where you lose that pain sensation. So most likely that's where the disc is kind of ruptured. And so for Cosmo, he was T12, T13. So I would pinch all the way up to his tail, his toes. He wouldn't feel it. He was unable to walk. So his prognosis was not the greatest in terms of his road to rehabilitation. The earlier you are able to detect these signs, the better off they can. Here's my general rule as a veterinarian. For those of you that want to write this down, you definitely should. And it's very simple. If they wag, they walk. If they wag, they walk. So if a dog is down for the count and back legs, let's say, for instance, and they can't physically walk towards you, but they're like shimmying towards you, but you see their tail wagging, there is a very good chance that their road to recovery will be very good because there's still some neurologic function that's there. So that's kind of like a neurologist perspective too, just to give you an idea. So an MRI is usually the gold standard. Now, again, this is an expensive thing. So again, I have to set that expectation in the exam room to tell the pet parents, this is going to be this is going to be significantly a life changer for both, the dog as well as for you, because financially you're looking at maybe $9,000 to $12,000 worth of a back surgery, including MRI and rehabilitation, surgery, post-op recovery, rehabilitation, time off of work, those kinds of things, learning how to express the bladder. And so the reason why those are so important is because when you have a disc protrusion that you see here on this dachshund, the red area that's inflamed that you see where it says a prolapsed intervertebral disc, it's pushing up on the spinal cord. So spinal cords can be forgiven, but with time. So surgery is required to remove the ruptured disc material, but that sensation is because it's been pressed on the spinal cord, it's gonna take some time for it to generate and recognize the back legs. And this can also go for front legs. I've had mastiffs, for instance. Think of like a Neapolitan Mastiff, like a 150-pound dog that is down for the count on all four legs, that is completely tetraplegic on all four legs. So they require lots of rehabilitation because they're big. So they're usually in the hospital in 2 to 3 days. This is what I like about the research on IVDD now, is they used to be hospitalized for quite some time. Now they're only in the hospital for 2 to 3 days max, and they go right into physical therapy and they get you walking and into some things I'm going to show you about in a moment. But so that's the good news. What are some reasons for intervertebral disc disease, also known as IVDD? There could be what's called an FCE. There could be a blood clot that could be thrown to the spinal cord. We can see this, usually we see this in the larger breed dogs. So someone like a German Shepherd can do this. So for instance, they go, the classic history is like they're playing ball, they jump up to catch the ball or catch a Frisbee, and then they're down for the count completely. They're paralyzed in the back end. And so, you go ahead and you take an MRI and you see like a blood clot that's on them. So that could be very, very serious. Tick paralysis can do this too. So make sure that the fur babies are on a good, flea and tick preventive. You have a good discussion with the veterinarian about that. Trauma, metabolic conditions, chronic issues too. So, as animals get older, this isn't exclusive to a particular breed. This can be in any animal too. They start to develop arthritis, their back legs start to go down. So, there's other reasons for them to have, back leg issues. Degenerative myelopathy is a big thing, and it's a hot topic right now because there's a lot of research that's being done to treat and hopefully cure degenerative myelopathy, because right now it's not necessarily treatable, it's manageable. You see this a lot in the German Shepherd breed dogs, and they tend to, their back legs start to fall down a little bit more, and then eventually they collapse at the back end. And then you can also have disc inflammation, known as discospondylitis, that's there. So this poor little dachshund is so delicious, you guys, right? How freaking cute. I can't even take it. Look at those back legs. So that's not normal the way that they're sitting. So that, and also the ears are back. So someone's painful, and it's this one right here that you see in front. So pain management right away. You want to get these guys nice and comfortable, and then have that discussion about sending them to the neurologist for an MRI, whether or not it's warranted. So degenerative myelopathy, remember, like I said, is not necessarily no cure, but palliative treatment has come a long way. Essential fatty acids, acupuncture, laser therapy, physical therapy. And so when they have this abnormal gait, like you see on the left there, that gives you an idea that there's degenerative myelopathy that's occurring. Now listen, working with your veterinarian can work up that diagnosis, but I'm just giving you an example, of course. But lots of nutritional supplements are out there too. Some alternative medicine has been shown to be of help. So, there are some options that are out there. I love integrative medicine. Who doesn't? Who doesn't like, kind of getting Eastern and Western medicine together and doing what's in the best interest of the fur baby? Acupuncture works. It's scientifically proven. Studies are showing that it's working, and it really has taken on a life of its own, which is great. So, and I love it. So 2 of my dachshunds did go down with their backs, IVDD, intervertebral disc disease. And I swear that the 2 pictures that you see here on the left and the bottom right is what got them on their road to recovery. So acupuncture really does help stimulate those nerves to help increased sensation and also for pain and inflammation. It's interesting because dachshunds are so sensitive to like needles, but after the second session, both of them were always just like, oh, it feels good. Because, you know, you're releasing the good endorphins and all those things that are making me feel good. And then the top right is about carts. Now, quick little thing and mention on carts. It's not for everybody, you guys. It's not for everyone. So, you know, getting them fitted is really important. So working with your veterinarian and a website that can develop and create a cart that's designed for dogs is important. So this German Shepherd dog, for instance, has a really nice one. And what I like about this is that it's lightweight. So caninecarts.com, there's a whole bunch of different carts that are out there, but you got to make sure that you measure appropriately for these guys. And this is lightweight, which is nice. I want to say it's probably like under 2 to 3 pounds. So they're not really feeling it. Years ago, it used to be like heavy metal material, and that really was affecting these guys. So now they're realizing that the PVC type of piping, that kind of material helps these guys because it doesn't wear too much. But remember, my Cosmo, for instance, he did not like the cart at all. So I created a resistance band that I'll show you a video on in a moment. But this underwater treadmill therapy that you see, also known as hydrotherapy, it's a 10. It's a 10. It's well worth the rehabilitation because it's creating motor action. So the tank is only filled up just enough to give and provide some buoyancy to this dog. And so what they usually have on the tank on the left actually is a little dab of peanut butter or something enticing that they like. The treadmill goes off for maybe like 1 or 2 miles an hour, very, very slow. And over time, because this isn't something that they do just once and that's it. This usually requires like once or twice a week of therapy for 6 weeks or so. But they'll look at the analysis of the gait, of how they're walking. So is there any knuckling or wear and tear and those kinds of things? Do we have that motor activity happening? And it provides the buoyancy. And I'm telling you, and I've heard this from all the pet parents that have done this, some of the dogs that hate the water love the hydrotherapy because they know, again, resiliency. These guys know what they need to do. They get in the zone. When I say, guys, it's time to go in the hydrotherapy tank, they know like it's game on. I need to get walking again. I want to walk. I want to run. I want to chase and eat a chipmunk. So they'll do whatever it takes. They know they will be forced to do it. Once they're in it, I'm telling you, you'll be pleasantly surprised. And you can do these things at home. This is what I love. When you work with CCRPs, certified rehabilitation specialists and technicians, they will give you some ideas at home to do. For instance, this is a black Labrador retriever dog where they were instructed because his gait was not right with his back legs, recovering from surgery. And so again, easy, you get cones, PVC pipes, throw him in, let him try to realize that there's obstacles for him to walk over. And that will help work and trigger everything upstairs to tell everything down below. You need to get those legs moving in the right gait format. Very simple, and you can challenge it. You can go higher, you can go lower with these things. One of the things that I've loved are the pillow cushions at home are super easy to do. Like if you have a small dachshund like I do, instead of using a Bosu that you see in front of you, you could just easily put your dachshund right on the cushion. And what I do is I just move it. And what that's doing is that's increasing their core because these long back dogs don't have great core because their muscles aren't stabilized in their spinal cord well. So by you moving them, they're working things. They don't want to fall. They don't want to fall. I don't want to fall. You do that for about 5 minutes, twice a day for a couple of weeks. You do that at home. You can do that while you're watching a show, whatever, multitasking, giving them a treat, whatever it is. But those are things that you can do at home that work great. The team approach is the best method, hands down. Working collaboratively with the veterinarian, so even sending them over for doggy rehab, and whether that be acupuncture, laser therapy, hydrotherapy, and then at home exercises to do. I think they're great, but you have to set the expectations early so they know what they're looking at. So, you know, I want to close here by just talking about the fundamentals of basic nursing care. So this is what you as pet parents and me as a veterinarian, we work together on. You know, if these guys are down and they're not moving, you got to make sure that you're moving them because they could develop decubital ulcers, especially like if they're giant breed dogs like the Great Dane that have cervical issues. You want to make sure the urine is okay. They're not having urine scalding back there. The carts, harnesses, hoist slings, whatever works, passive range of motion exercises. Those are super uber important for these guys because you want to make sure, listen, these guys are not going to be able to walk to their food dish. They're not going to be able to have a drink of water. You've got to make sure you hand deliver that to them. So if they're giving you some action verbs or whatever it is, like say, hey, oh, ruff, ruff, I need something. You have to know their cues. You got to be in sync with them. So you got to keep those things in mind. This is why I wrote a book about this, is because there's so many things that come into play that me as a veterinarian, I don't have necessarily like the 20 or 30 minutes to spend talking about bladder expression, but I'll send them to my YouTube channel or to this book that I have, because expressing the bladder is not easy right away. But once you figure it out and know the anatomy, and I give some great little tips and tricks in there on how to do it, whether you have a male or a female dog, because it's different for both. It's not impossible. Also keep in mind that if you have a permanently paralyzed dog, you're always going to need to express their urinary bladder because they don't have the function to do it. So you have to do that permanently. And then you also have to help massage them with fecal material too, because they are going to, what I call it, they drop nuggets. So I would have a routine, like understanding Cosmo's routine of like when he eats and when he's due for a bowel movement. Those are important because I don't want him laying in it, of course. And so I really, really big on that. Also, in the picture on the left, keep in mind of nail wear. This is important, pet parents out there. I want you to understand this because they can develop horrific infections to the point where they can get sepsis and bacterial infection. So utilize booties. There's a whole bunch of websites that sell these things. As they're getting their mobility back, or if they're permanently paralyzed, like the one in the left, you want to make sure that they have something to cover their nails and nail beds so they're not getting infections. I want you to really be mindful of that, okay? Because that's something that I see often that doesn't have to happen. Swimming is the reason. So this pool is the reason why we got Cosmo is the reason why we got a pool, is what I should say. Is I didn't really want one, but realizing that we'd have to do hydrotherapy would be important for him. So, and he loves the pool. Every time we would open up the door, he would love it. So he lived another 12 years until he developed nasal carcinoma of his nose, which is just awful. Like, bad enough that the poor guy was paralyzed, but he lived a very wonderful life. And he was surrounded by so much love too. And having a great groomer like Jackie understands the breed and knows that he's paralyzed. So I'm going to do a window clip, like make his honey look like a monkey so he doesn't get any fecal matter back there, no urine scalding. Work with your groomer because they understand it, or know a groomer that understands the paralyzed dogs and the needs and wants that they require, because it's important. I want you to understand that. So it's a team effort, veterinarian, veterinary technician, you, and a groomer, because you need all of them. I want to show you a video of Cosmo. This is on an Easter Sunday. We have a Easter egg hunt, and it's really cute. So I'll explain it as we go. So they open up treats.
Hey, we got eggs, everybody.
There's my gaggle, my pack.
Kazi gets one over here. Kazi,
And
here.
that's just the resistance band that Cosmo has.
Charlie got one. Hey, Charlie.
So I'll show you. Everyone's opening up their little eggs. There's Kazi.
Chelsea got one over there.
And all he wants to do, Cosmo, is eat the egg. Get it to the treat. So
Kazi,
cute.
look.
So that's him. They can live a wonderful life. I hope this inspires you to help those animals with special needs. I have a website, dradamchrisman.com, for more information. I do regular blog posts about this too. I'm on Instagram. I have a YouTube channel, and I have a Facebook page as well. So I invite